Wildcat. This has been a rough weekend for me as a Florida Gator fan. But congratulations to Dr. Ross and the University of Kentucky. I think it's the first time in like 75 years they've beaten Florida in back-to-back games. Not that I'm paying attention to it. I love Fred Weaver's talk about the vascular surgeon's role, and I love the fact that he suggests that we should communicate with the executive suite in our hospitals. I would suggest you run the executive suite in your hospitals. And that actually, as a chair of surgery, asked Tom Huber how it's going for him, and I would suggest he'd probably say it's going pretty well. So I'm going to spend the next 14 minutes talking about why vascular surgery needs millennials. And as I look in the audience, I see a lot of millennials, and it turns out in order to actually, I won't say save, or I'll just say improve vascular surgery, we need millennials. So here we go. I thought this was ironic. I just moved offices, and I got this book when I was finishing medical school, Curing Healthcare. And we were going to cure healthcare with quality. This is circa 1990, and I'm going to come back to this, and I want you to just remember this picture. So we have a few problems in surgery. I'm not a Pollyanna. I'll lay the data out, and you can decide. We have a workforce shortage. I think Dr. Weaver just sort of alluded to this. The number of surgeons in the United States, and in particular the vascular surgery, we're going to be 20 to 30,000 surgeons short by 2030. We're all burnout, quality of life and burnout across surgical specialties. And here it says, let me highlight this for you, of the 16 specialties studied, including pediatric and endocrine, vascular surgeons were the least satisfied. So there are not many of us. We're all burnout. And it turns out diversity and leadership. Now, this is a really old paper, and it's very different now. But this is Bruce Perler, one of my vascular surgery heroes, who says, when I grow up, I want to be a successful, like Daddy. I just don't want to be a doctor. And this just showed trends. And this is in the mid-2000s. This is totally different. We have many, many more women going into vascular surgery now. So we're burnout. There are not many of us, and we're not very diverse. But other than that, everything's going great. So how can we turn this around, and how can we improve vascular surgery? And I love this tweet by someone maybe in this room, the millennial MD, who says, I love the idea of being a surgeon, but the lifestyle freaks me the hell out. I like surgery. I enjoy the technical challenges and the team environment, but I also like medicine. It's a big deal with big consequences for my life, and this decision is overwhelming me. And I think that's probably an honest improvement. So we need new strategies to swing millennials into vascular surgery. There are some in the audience who may actually not know what a millennial is, so I thought I would define what a millennial is as opposed to a baby boomer. A millennial is someone who grew up in the digital age. They're typically children of divorce. This is actually the first group of humans that actually grew up with a schedule, which I find sort of interesting. My wife and I try not to be hover parents, but you can see this. And the two we think of most commonly when we think of is Serena Williams and Ashton Kutcher. I would add Justin Bieber to this list as well. So that's what a millennial is. And why is that important? Well, it's important because as we think about our workforce in the next 20, 30, 40, 50 years, these generational differences they help describe different perspectives and experiences among people who are born during certain decades of the year. And we all know about baby boomers, the greatest generation ever, et cetera. And it's the values and expectations and ethos that sort of define these groups. This appears to be particularly amplified in medicine, where training, advancement, mentorship are steeped in tradition, and where changes often occur slowly. You're going to have to do it the exact same way I did it 30 years ago. But let me just bring something to your attention. This slide is from a JAMA Surgery article that individuals born between 1980 and 2000, the millennials in 2018, when I first gave this talk, was only 25% of the workforce. Look at the very bottom of that. In 3 years, millennials are going to occupy 75% of the workforce. So it's pretty important that we reach out to these people. So this is my case scenario. There are 3 members of the vascular surgical team, including Dr. Ross, our fearless president, and they're standing at the scrub sink when Dr. Ross notices the resident punching on their tablet next door. And it's sort of annoying. They're going in to do this sort of acute PE. It's the middle of the night, and he's just sort of like, it just sort of gets him on edge. And so he just sort of, and his total gentlemanly way, says, "What are you doing over there on the tablet?" And the student or the resident looks, or the student looks over him and says, "Well, I'm just looking over your most recent paper on pulmonary embolus, and I'm wondering if we're going to use the ECOS catheter or if we're just going to do thrombolysis on this patient." Dr. Ross just sort of sits back and he sort of thinks to himself, and he goes, "Well, that's actually an interesting question." And the student subsequently puts the tablet down, scrubs in, goes in and does the case with Dr. Ross, ultimately offers to help Dr. Ross put together his series of complicated PEs, and that person is now in the audience presenting at the Georgia Vascular Society. So why did I tell you that story? This is the reason. Millennials learn differently. They're learning off the tablet as they're going into the thing. So we need to mentor or teach them differently. So that's a really important thing. I have 3 tactics I'd like to give you to engage. This is from an article written by Jen Walge, who's a plastic surgeon at the University of Michigan. Micro-mentoring is something that actually occurs over a short period of time. It doesn't necessarily, and it can occur over a cup of coffee. It doesn't have to be rigid. And it has more to do with sort of frequent and rapid meetings when the mentee actually needs your input. So micro-mentoring, rather than these scheduled 30-minute, 1-hour meetings in your mahogany office, this could be done at a Starbucks or a Dunkin' Donuts. How about reverse mentoring? This actually is very helpful. It creates a flat leadership structure. When I interview somebody, I walk over to the medical school and sit down on some sort of chairs that are sort of at the same level as opposed to behind my desk and stuff. And it's when the younger person imparts perspective, skills, and guidance to other colleagues. I know you can imagine that's often around technology in our particular cases. And the classic example of that is with the use of Twitter or LinkedIn, when they're sort of helping you to disseminate research. And this counters the sort of flat versus perimeter infrastructure that we all grew up with. And this is actually heralded by Chelsea Harris, who actually helped to develop the visual abstract. This was a visual abstract from a couple of years ago when I was the Research Day speaker at the University of Michigan. But this was developed by a millennial. So I think this is really sort of cool technology that we sort of all use and see all the time. This has really been embraced by a place like Nike, where the senior executives are taught things by early career stages, people who work at Nike. And so I suspect this was a shoe. My people in the audience who are from Duke, and there are way too many of them, would recognize this shoe. This is a Zion Williamson shoe. That was probably designed by a baby boomer versus this sweet Air Jordan, which was designed by a millennial. So nonetheless, Nike's embracing this. And how about the third technique we can all use? This is mentorship teams. It has, you can basically include people who are sort of outside the norm. They don't even have to be in surgery, for God's sakes. You could include a medicine person or a pediatrician on this, different academic levels, assistant and associate professors. You may even bring in quality and policy people, and this counters the whole concept of purpose versus process. So those are 3 techniques. The mentoring revolution is occurring, and it's really up to us to get on it. While we're sort of standardly used to this as the sort of standard mentoring pattern, recognize that today, this is more what mentoring looks like. Groups of people all moving in the same direction around a common purpose, and that purpose, quite honestly, should be vascular surgery. So I'm not here to tell you something you don't already know. And listen, I trained in 10 years at a place that was steeped in tradition. They would not, I'm left-handed, they would not teach me how to operate left-handed because the guy said the instruments are right-handed and you're gonna learn how to operate right-handed. And I love that, and I respect that tradition. But at the same time, we need to also engage young people in the process because they have an amazing number of ideas, especially around technology, and there's an absolute ton that we can learn from them. And there will be evidence of that later today when the residents and the medical students are teaching. So as we look into the next century, and we want to make vascular surgery the best specialty it can be, Bill Gates says leaders will be people who empower others. And it didn't say anything about the oldest or the wisest, and I think that's really important. So I started off my talk with this book, with saying we were going to cure healthcare with quality circa 1990, and this is the way I feel today. This is my group of chief residents. You can see they're pretty diverse. The guy in the middle there has a ponytail, and about 3 of these people actually went into vascular surgery. So it's my impression today that we're going to improve healthcare, i.e. vascular surgery, by inspiring millennials to actually go into vascular surgery. So thanks very much for